Hi, and welcome to Nurse on the Go videos. Today I want to talk to you about how to care for an arm splint when you have one. They are tricky business. I've got one at the moment, and there is a few things that you need to know to make sure that you're doing everything right and that your recovery time will be the shortest it could be. So first thing is, why do you have a splint? Now the doctor will give you a splint to keep your arm, wrist and depending sometimes your fingers immobilized. That means he doesn't want them to move, and there's a reason for that, because any surgery that they've done, depending what they've done, maybe nerves or ligaments or anything, that surgery needs time to heal. And if you try and do full range of movement, so move your fingers all the way backwards and forwards too quickly, too early, you can actually do more damage. So that's why they keep it there, just to keep it all nice and still for you. So that's why we keep it immobilized. What about making sure that, if you've got swelling, especially after surgery, you'll have swelling for a few days to a couple of weeks. I've actually still got swelling now 4 weeks later, so it does hang around a bit. What can you do to decrease it? Well, try and keep your arm elevated all the time above your heart. So your heart's just about where your left breast would be, so just try and keep it up there. Even when you're walking in the day, keep it elevated. Lying down in bed at night, have it on a pillow, and that will help the fluid drain out of it. It will take time, but it will slowly go down. The hand therapist can also, they'll probably put something, an elastic stocking called a tubic grip, and that just helps with compression, so that forces the fluid out of your limb and into the rest of your body. Other things that will make it swell actually would be if you got hot, so if you're in hot humid weather, that will make it actually swell up a bit more as well. So if you can keep yourself at a nice, cool, even temperature, that will help bring down your swelling as well. Other things to remember with the splint is the straps on the splint. They are Velcro, and sometimes they can get all mucky, so just make sure that you keep your splint clean and don't let it lie around on the ground and things like that with your arm, or in somewhere where you get all the lint all built up, otherwise that strapping will start to fail on you. Other things to think of is pressure areas. That's a big one, especially when you've got a new splint and you've got all that swelling, because what happens is as the swelling goes down, your arm actually changes and the splint might need to be remoulded. If that happens, go back and see your doctor or hand therapist so they can remould it for you and get it fitting comfortable, because the last thing you want is a pressure area. So when they actually first fit the splint, if it's not totally comfortable, say so, because that little niggly bit of going, oh, I'll be right, I'll work around it, actually over a few days, because you've got that splint permanently on, will build up and build up and build up, and actually can wear away at your skin and cause a little pressure ulcer. So if you feel like you go, oh, there's a bit of pressure there, and the guys will quite happily remould it so it sits comfortably, because you're in it for 24 hours a day, don't forget. So make sure it is all nice and it's not causing pressure anywhere in one particular spot. Other things to think of is the tubic grip that goes on. Make sure that it isn't too tight. It's got to be firm, because its job is to push the blood back down, but not too tight. And the way to tell is if you get pins and needles in your fingers. If you've had nerve damage, you probably have no feeling there anyway. Also, you can tell your fingers will go a paler colour or slightly mottled colour. And a good thing to do is a capillary test. So what you do is press on the tip of your finger, it will go blanch white, and then let your finger go, and it should take about 2 seconds to return to normal. If it comes back instantly, it might be a bit of blood pooling there, or if it takes longer than 2 seconds, like 4 or 5 seconds sort of time, it means the blood's going too slowly, and you should seek medical advice to have a look at your hand, see what's going on. Other things is to keep your arm dry. So when you have a shower, put a plastic bag over your arm and tape it. Now the arm isn't to go into the water too, it's only for splashes, it's not for submersing in baths or pools or anything like that. Because don't forget, you still have a wound underneath that needs to heal, and it needs to stay dry, otherwise you'll increase your risk of infection. So keep it dry. The other thing about keeping your arm dry as well is decreases the amount of odour. So if you get any smelliness, it'll decrease that as well. The other thing that having a wet, like tubey grip will do is make your skin all white and start to peel, and then you can get other skin problems underneath, which you want to try and prevent as well. So that's a few handy tips there. Hope they help you out. My name's Phil. I'm here to help you care, and thank you for watching Nursing Go videos. Bye bye for now.